I am Dr. Özlem Biçer. I have been medical doctor for 20 years. I have been doing hair transplantation for 20 years approximately. I have been doing FUE for 15 years in Istanbul, in Turkey, in my own licensed clinic. I have been doing FUE for 15 years in my own licensed clinic. Approximately 3,000, how can I say? I do one patient in a day, generally 3,000 or 3,500 grafts in a day for a patient, at least 2,500 grafts, maximum 4,000 grafts per day. No, I have never done automatic systems. I don't have any experience.
What is the reason?
I think that tissue is very important for the patient, and the doctor has to feel the tissue. Automatic systems, I think, this is a robot, cannot estimate, cannot feel the tissue, and I don't want to make any trauma to the tissue. I want to feel the tissue, feel the depth of the root, I want to feel the grafts. So I decide a lot of things during the procedure. For example, when a patient has grafts, single grafts, I arrange the punch. I arrange. When a patient has triple grafts, I change the punch every time, and I decide a lot of things during the procedure. But if it is a machine, how can it decide it? So it is important. Donor area is very important for me. I'm a doctor. I have to protect the donor area, and I have to feel the donor area. I have to feel the grafts. I'm not a machine.
Are you working manual or with the device?
Generally, I use micromotor. I may do manual, but I don't prefer it because I want to standard the procedure. For example, by micromotor, I can give the same pressure to the tissue. It is standard. I want to change it. If I may change it at the beginning, but every time I don't want to arrange it. I don't need it. It is standard. So I know what is going to do after the procedure. I know the trauma of the skin. But if I use my hand every time, I cannot give the same pressure every time. At the beginning, my arm is strong and I may give hard pressure. At the end, low pressure. So this affects the donor area, I think. So generally, I don't prefer it, but a lot of doctors may prefer it. I respect them. It doesn't mean that it is bad technique or this is the good technique, but this is the prefer. I prefer micromotor generally.
You do your hair transplant yourself with assistant, or what is your role evaluation in the surgery?
I do only one hair transplantation in a day. I do only one hair transplantation in a day with my team, with assistants, but I am with the patient all day. I do the surgery part. I collect the grafts with my team together. I open the holes only by myself. I do local anesthesia. But putting the grafts is done by my team, not by myself. I want to be with the patients all day. I am with the patients all day. But while during the nurses putting the grafts, I am also with the patients and I check them every time. I do the surgery by myself, the surgery part, but preparing of the patients, just for example, filling the forms, shaving the hairs, of course the assistants will help me, of course.
Is there any specific point which you think is most important point in hair transplant? Crucial?
Yes, there are a lot of tricks for hair transplantation, I think. a lot of important points. You have to be careful on about a lot of important points because all these points affect the result. For example, if you don't draw a good hairline, your result cannot be natural. If you cannot choose optimum punch, you may disturb the den area. If you cannot organize the good slit, yes, your result will not be good. A lot of important tricks, a lot of important points, all of them will affect your results. So I think I learned them, of course, during the years. I learned a lot of things from my friends, from doctors in the European, in United States, in Turkey, and we tried to find the best procedure. Although we are experienced, I always want to improve the technique, improve my team, improve myself. Otherwise, we cannot be successful, I think.
There's a crucial question about people who think they don't have enough money to make a hair transplant. So they are on a budget. We know we have offers starting around 1,500, 1,300 euro. People say, I don't have not more money. What is your opinion about that? What you would recommend to such a patient?
No, I generally say that the price is not important, of course. For a doctor, for this kind of important procedure, but if you don't have enough budget, please wait. Why? Because your donor area is very important. It is limited, okay, and you have to use your donor area very, very. How can I say? You have to think before it, okay, because you cannot take it back. So it means that if you don't have enough money, wait 1 year, because it is your face, it is your image, it is you. I know the patient has a lot of expectations. So if you want to get your expectations, you cannot get them cheaply. It is impossible. Quality cannot be cheap. It is impossible, because I think the most important thing is hair transplantation is a medical procedure. So I don't suggest you lose your health, okay? Because it's a kind of small surgery. For example, if you have contamination, you may have a hepatitis C. If you have contamination, you may have hepatitis B. If you may have a lot of infections, you may have a lot of risks. You may lose your donor area. A lot of important points you have to consider. You have to be careful about your health. Wait. I think I suggest you to wait. In that case.
Okay, very different question. What do you think about the additional medical treatment, like finasteride, for example?
No, I think minoxidil or finasteride, yes, we may use it, but generally I say that don't take it without any doctor comment, okay? Why? Because these are medicines, okay? These may have side effects. First, the doctor has to check your liver, your spleen, some blood tests. Then, while you are using them, we have to check them also, okay? For example, it is not a spray, it is a medicine. So, if your doctor say that use it, please use it, but do your periodically blood controls. Otherwise, I think your health is very important. Otherwise, don't use it by yourself.
Okay, thanks for the moment. Anything else which you want to comment, say?
While you are choosing a doctor, a clinic, or somewhere else, I want you to be careful about 2 or 3 objective points. First of all, please touching contact with the doctor directly. It is important because your operation, your procedure, your hair transplantation will be done by the doctor. It is important, it affects your result. The second important point is, please ask the license, because I think the black market is very important from now on for the world. So if you don't want to have a bad experience, be careful about the license. Want from the clinics the license, okay? And the third one is the experience, I think. And the last point is the money.
Habt ihr noch Fragen? Dann schreibt uns einfach. Und wenn das euch gefallen hat, dann gebt uns einen Like.